Hey, this is Matt. I had hip surgery on my right hip. I had a hip resurfacing with Dr. Gross about 3 months back. And at the 6 weeks mark, I started doing some physical therapy that was recommended by Dr. Gross. And I've been doing it up until now. I thought I'd show you some of the exercises on this video. So it's exercises and stretching. The first one is just, and I'm on here on a yoga mat, is just a quad stretch. So laying down, grab the leg, quad stretch down here like that. And I was doing it for about 20 seconds, hold, and then rest, and do that about 5 times. That's what I was doing. The next stretch would be laying down and have your feet together like so, and you're pushing down on your legs, and I did about similar times for that, but you just push down gentle. You don't want to hurt, you just want to feel a stretch. I would do it for about 20 seconds, and then I'd rest them, do it again, and I'd do that about 5 times. The last stretch, or not the second to last stretch I should say, is kind of reaching down to your toes, feet together like this, knees apart, and you're kind of reaching for the leg that had the surgery. Reaching down here towards the shoelaces, kind of an angle. Feel a stretch in the back here, back of the buttocks, kind of, as you get down. And I would do that for, I believe it was around like 15 seconds. And then take a break, do that 5 or more times. Just judge by about each time I was able to reach a little bit further, and then I'd kind of hit where I couldn't reach any further. And then the final stretch was usually against a wall, but I'll just use the chair here. And again, you're just on your leg that you had surgery on. You kind of lean against the wall and pulling the leg back. So if I do it against this wall here, put my hand against the wall, and you kind of pull the leg back like that. I believe that was called the psoas stretch. And then in terms of exercises, it was leg lifts, and start with your leg you had surgery on straight, other knee bent, and you're up for a count of 10, slow count of 10, and then you rest it. And for this one, you want the leg about a foot off the ground, but you're focusing on tightening the muscles in the buttocks as well as the quad muscles at the same time. So everything here is tight, and then you rest it. And you start off doing that about, you're going for 15, and then I'm kind of working my way up to 30. And after I get to 30, which I haven't yet because I've been going up kind of slow just based on how my leg feels, you're supposed to add a pound. Start back at a lower number, work your way up to 30, add another pound. So I'm not there yet. The next one is on your side. Just kind of leg bent. Probably not the best view. I'll see if I can get a different view here. But it's the same thing, side leg lifts. Like this. And you just go up about 2 feet. And again, you're tightening in the quad and the buttocks. And you hold for this one for less, like count of 5, and then take a break. And again, you're working your way up to, starting at 15 with no weights, up to 30, and add a weight, one very lightweight, 1 pound, and work your way up to 30, from 15 to 30, and then do it with 2 pound weights. Again, I haven't added the weights yet, and one suggestion he has for if you don't have weights is just put a can of soup in like a purse or something like that and put it over your leg. So when I get there, I'll add that. All right.